Maayong adlaw everyone! Welcome back to my channel. If you are new to my channel, my name is Cor and I'm your business nurse from Southeast England. Welcome back to my current subscribers. If you are new here to my channel, please don't forget to like this video and subscribe to my channel. In today's vlog, I'm going to share to you the most common medications you will encounter when working as a care home nurse. Note that I won't be discussing the technicalities of these medications, as my aim is for you to familiarize them and to give you other useful inputs. So top of the list, guess what? Yes, you got it right. Pain relievers, or what they usually call here as painkillers. The elderly experience pain more often, obviously because of their physiological changes and their multiple health conditions, or what we call the comorbidities. The main goal in working in a care home is to maintain the quality of life of our patients or residents, and the top most priority is for them to be pain-free. So what are the most common examples of painkillers? Number one is paracetamol. So this comes in tablets, dispersibles, and liquid forms. So the form of the medication will depend on the ability of the patient to swallow, the cognition, and their personal preference. So the timing of paracetamol is usually every 4 to 6 hours, and it is important to know the guidelines when it comes to administering paracetamol. So please refer to the slide that I will insert now. The second most common painkiller is the codeine, so it is an opioid. And then the third one is cocodamol. This is a combination of codeine and paracetamol, hence the name. So it is crucial that a paracetamol and a cocodamol should not be given at the same time because both drugs contain paracetamol. There should be at least 4 hours apart in between these two medications. And for those residents who suffer from joint and muscle pain, they're also prescribed with topical painkillers, and the most common medications for that are ibuprofen gel, piroxicam gel, and lidocaine patch. So take note that this effect can be considered as systemic. And the last resort for the pain reliever will be our controlled drugs. So examples of these controlled drugs that are given orally are Oromorph liquid. Oromorph liquid contains morphine. And then we have oxycodone tablet, oxycodone liquid. And if the resident is not able to swallow anymore, and it is more common for our residents who are in palliative care or end of life, we tend to give them painkillers that are in injection form. So the common injection forms of painkillers are oxycodone and morphine injections. Another controlled drug that is commonly given for our residents is in topical form. So it is the Butec patch. Another most common medications you will encounter as a care home nurse would be, guess, laxatives. So the elderly people are prone to constipation due to factors including decreased metabolism, advanced age, suboptimal nutrition, reduced mobility, and to a lesser extent due to medications such as opioids. So examples of these laxatives are Senna, Docusate. So both of these medications can come in tablet, capsule, or liquid form. We also have Lactulose liquid, Laxido powder, and our last resort is to give suppositories and enemas. So it is important for you to know that laxatives can either be given regularly or when needed. So it is crucial for you as a care home nurse to monitor the bowel records of your residents for you to anticipate if the resident needs a laxative or not. Okay, so now let's move on to our third most common medications. So these are our cardiovascular medications. So this is a vast category, but I will only tackle the usually given medications in the care home. So these medications cover cardiovascular diseases like hypertension, coronary heart disease, heart failure, and so on and so forth. So let's talk about the medications that regulate the blood pressure and help improve or control the heart failure symptoms. So as for the ACE inhibitors, the most common is lisinopril and ramipril. And then for the angiotensin receptor blocker, we have losartan and candesartan. Calcium channel blockers, the most common that we usually give in our care home is amlodipine, felodipine, and diltiazem. For the beta blockers, we have atenolol and bisoprolol. For the alpha blockers, we have doxazosine. The most common also cardiac glycoside we give is digoxin. And then for the diuretics, we have furosemide, indapamide, and bumetanide. It is extremely important that the patient's vital signs, especially the blood pressure and the pulse rate, are closely monitored prior giving these medications. So other medications relating to cardiovascular diseases are our statins. So this group of medications delay the onset of narrowing of the arteries, hence slowing the progression of cardiac diseases and its symptoms. So the most common statins that you will encounter in the care home would be the simvastatin and atorvastatin. Another group of medications would be the antithrombotics. So this can either be the antiplatelets or the anticoagulants. The antiplatelets prevent platelets from clumping, whilst anticoagulants reduce the fibrin formation, where both types prevent clotting. So these medications are prescribed to reduce the chance of heart attack and stroke. So examples of your antiplatelets are aspirin and clopidogrel. And as for the anticoagulants, we have apixaban, dabigatran, edoxaban, and warfarin. This group of medications are quite of a big deal not only in the care home sector but also in the hospitals. So in fact, it is a top consideration when phoning for ambulance support. So they usually ask initially whether or not the patient or the resident is taking these drugs. So for example, if the resident had a fall, head injury, or bleeding episodes, it is important that the call handler will be informed that the resident is on blood-thinning medications. Now we are down to our fourth most common medications in the care home, and that would be the adjuvant medications. So this group includes antidepressants, anticonvulsants, corticosteroids, and neuroleptics. So adjuvant drugs can be used to enhance the effects of pain medications, treat concurrent symptoms, and provide analgesics for other types of pain. Now let's discuss the examples of these adjuvant medications. So as for the anticonvulsants, the most common drugs you will encounter would be gabapentin and pregabalin. Gabapentin is one of the new promising drugs as an adjuvant analgesics for neuropathic pains. The next category are our antidepressants. So the most common drugs in this category would be the amitriptyline, duloxetine, and venlafaxine. The next one is the corticosteroids. So these are prescribed as an adjuvant analgesics for cancer pain and neuropathic pains. So examples of this are prednisolone and dexamethasone. So working as a nurse in a nursing home, you will also handle residents who are living with dementia. So this will be our fifth common medication, dementia-related medications. At present, there is no cure for dementia. However, there are medications to help to manage some symptoms associated with dementia. So the most common drugs you will encounter for dementia are cholinesterase inhibitors, which are the donepezil and rivastigmine. So this help to treat the symptoms of mild to moderate Alzheimer's disease. Then we have the glutamate regulators like memantine. Memantine is given to people who have moderate or severe Alzheimer's disease, dementia with Lewy bodies, and those with a combination of Alzheimer's disease and vascular dementia. So memantine is suitable for those who cannot take or are unable to tolerate the acetylcholinesterase inhibitors. There are also medications to treat the symptoms of behavioral and psychological symptoms of dementia like increased agitation, anxiety, wandering, aggression, delusions, and hallucinations. The most common medications for this that you will encounter are risperidone, lorazepam, and haloperidol. Last but not the least, the other medications you will encounter are diabetic management drugs, and these are your metformin, glycoside, and insulin injections. You will also encounter medications that control the symptoms of Parkinson's disease, and these are the carbidopa-levodopa medications. Example is Senimet. So please do not be overwhelmed with all the information that I have shared to you. The medications in the care home, they come in boxes, so there is a leaflet inside the medication. And not only that, you will have your British National Formulary Book or BNF book that also comes in digital form. So do not worry, this BNF is always with you in your medication trolley. So just in case, if you have any medications that you are not familiar to, then you can just browse your BNF book, okay? Also, you will not be able to give medications without completing your trainings and without passing your competency assessment. Okay, so that's a wrap for today. We have covered the most common medications that you will encounter as a care home nurse. So if you have friends who are planning to join the care home sector, please share this video. So that's it, guys. Hopefully you find this vlog valuable. And if you're new to my channel, please don't forget to hit the like button and subscribe to my channel. And if you want to know if I have new release videos, please hit the notification bell to keep you updated. Thank you so much for watching, guys. I'll see you soon. Bye-bye!